Hello everyone, I am Katrin Kimadibon and a student nurse at Davao Doctors College. Today I will be performing marathon demonstration about perineal flushing. So now prepare all the needed materials and also perform hand washing. Preparing materials will save our time and energy, and performing hand washing will deter the spread of any microorganism from our hands. Now I have here a container with warm water, a kidney basin, gloves, bedpan, dry cotton balls, and cotton balls soaked in antiseptic, bandage, scissor to serve as my forceps, perineal pad, a sheet to serve as my draw sheet, and the blanket for the patient. And now explain the treatment to the patient. Good day, ma'am. I will be performing my perineal flushing. This is a way of cleaning your genital area to remove perineal secretions, odor, contamination, or any infection. Now I will be exposing your genital area for this procedure to be done. Is that okay with you? Okay, now screens the patient or locks the door of patient's room. This will provide privacy to our patient. Now position the patient on a dorsal recumbent, puts the patient on bedpan, and also don gloves. Now drapes the patient, exposing only the parts to be cleansed. Minimum exposure lessens the embarrassment and helps revive warmth. And now flush the perineal area with water. Flushing with water will prevent chilling and will soften and or dissolve any blood clots from the patient. And now get the cotton balls soaked in a cleansing solution using pick-up forceps. This will maintain the sterility. So now cleanses external genitalia, starting from the midline of symphysis, pubis down to the anus. Never retrace a stroke, and um, not retracing strokes will prevent contaminating the area. Now I'm getting the cotton balls from the mons pubis down to the anus and discard. And now with the second cotton balls, cleans the starting from mons pubis in figure of 7 by way of external labium towards the anus, and also discard. These secretions that tend to collect around the labia minora facilitate bacterial growth. Okay, from the mons pubis to labia majora down to the anus. And discard. And do likewise on the opposite side with the next cotton ball. This will ensure also that the opposite side is clean. From the now mons pubis to labia majora down to the anus. And discard. And now with the fourth cotton balls, clean starting from the mons pubis in figure of 7 by way of external labium towards the anus, and also discard. This will ensure that the area is clean. Now from the mons pubis down to the labia minora to the anus, and discard, and do the opposite side down to the anus, and discard. And now with another cotton ball, cleans growing starting from going up the thigh. Okay, from growing area up to the thigh, and discard. Okay, another side. Discard. Okay, now flush the perineum thoroughly with sterile warm water. And now using a dry cotton balls, dry the perineum with the same stroke as above. Okay, from the mons pubis down to the anus, and discard. So now do the mons pubis to labia majora down to the anus, and discard, and do the other side with another cotton ball. Mons pubis to labia majora down to the anus, discard. Okay, now then mons pubis to labia minora down to the anus, discard. Do the another side, discard. And now the growing area up to the thigh, discard. Other side, discard. So now remove the bedpan gently and turn the patient to side to provide, this is to provide comfort. So now if necessary, takes one cotton ball and clean one side of the buttocks, then clean the other side of buttocks and dry both buttocks, and dry also the both buttocks. This will ensure that the buttocks are all clean. discard, discard. So now, turn the patient on her back and make her comfortable. So this will ensure that we can have access on her back to the next step. Next step. So now sprays with antiseptic as needed. Spraying antiseptic will promote healing on our patient. So now, put the perineal pad with an up-down motion as needed. This is to prevent contamination in vagina and urethra from anal area. So I have here the perineal pad. So I'm done putting the perineal pad. So next, that's aftercare of the material used. This is to ensure that the materials used are all clean from the procedure we did. So now, records the treatment done to patient and discharges observed. This is for documentation purposes to prove that procedure is done and also the patient is done with her perineal procedure and I didn't observe any discharges. So I'm going to perform hand washing or hand hygiene after donning gloves. And now for documentation. Okay. Thank you for watching.